goes into it transitions from the transition is known as adolescence. What adolescent changes are there in children? Okay. So adolescent transition from childhood to adulthood. During this goes rapid changes in the body structure mediated by sex hormones. Sexual characters is coupled with changes in cognition and psychology. Whereas adolescent refers whereas adolescence refers to the entire process, puberty refers to the physical aspect. Puberty मतलब होता है physical aspect, entire process, psychological cognition, everything. So the age group 10 to 19 years जो होता है considered as the puberty marks the early half of the adolescence. Though it is a continuous process, adolescence is generally divided. पहला अर्ली होता है 10 to 13 years, दूसरा मिड होता है 14 to the third is late adolescence जो 17 to 90 years होता है. फिजिकल एस्पेक्ट हम लोग देख लेते हैं. दिस इज सेक्सुअल मैच्योरिटी 1 to 5 इन गर्ल्स. ठीक है, पहला क्या होता है प्री प्यूबर्टल है. ठीक है, टर्म ये हमारा प्यूबिक हेयर का बात हो रहा है, केवल प्यूबिक का हेयर, ब्रेस्ट का चेंजेस. ठीक है, तो फर्स्ट में क्या होता है प्री प्यूबर्टल ब्रेस्ट्स रहते हैं प्री प्यूबर्टल एंड देयर इज नो टर्मिनल हेयर. अपीयरेंस ऑफ ब्रेस्ट बड. सेकेंड वन इज ब्रेस्ट बड एंड इसमें स्पार्स स्ट्रेट हेयर अलोंग द लेबिया. देन वी हैव enlargement extending beyond the areola. एरियोला से दूर और जनरलाइज ब्रेस्ट एनलार्जमेंट होगा. पिगमेंटेड प्यूबिक हेयर पिगमेंटेड होने लगेगा, कोर्स होगा और बिगिन टू कर्ल होने लगेगा. एरियोला जो है वो फॉर्म करेगा एक सेकेंड माउंड ओवर द ब्रेस्ट और इसमें निपल और एरोला फॉर्म्स अ सेकेंड माउंड ओवर द ब्रेस्ट. और हेयर जो है increases in amount and spread over months. Okay, so is my voice clear? So what happens is, as we can see, that a woman goes that a child goes through in puberty. And adolescence is cognition, psychological plus sexual character. Pre-pubertal. Second is breast bud appearance, then generalized breast का enlargement, and nipple and areola जो है second mount develop करेगा. In the adult type breast हो जाता है. Nipple placed and areola receding, nipple projected. adult type pubic hair हो जाएगा ट्रायंगल शेप एरिया में, स्प्रेडिंग ओवर द मीडियल थाई. नाउ फिजिकल एस्पेक्ट देख लेते हैं. सो द ऑनसेट ऑफ प्यूबर्टी इज ट्रिगर्ड बाय वेरियस द बॉडी का फैट स्टोर्स कितना है. एक्टिवेशन ऑफ हाइपोथैलेमिक पिट्यूटरी गोनाडल एक्सिस जो होता है लीड्स टू द प्रोडक्शन ऑफ गोनाडोट्रोपिन. एफएसएच को स्टिमुलेट करेगा. एंड सेक्स स्टीरॉयड जैसे कि एस्ट्रोजन एंड टेस्टोस्टेरोन ये सबको स्टिमुलेट करेगा. स्टीरॉयड्स जो होता है ब्रिंग अबाउट सेकेंड डेवलपमेंट, increase in penile size and menarche. Whereas adrenal androgen जो होता है ये सेक्सुअल और एड्रिनल एंड्रोजन जो होता है causes development of sexual hair. हेयर्स जो सेक्सुअल हेयर है ये एड्रिनल ग्लैंड कर रहा है और ये जो है सेक्सुअल हेयर, acne and underarm odor. Now details of hormonal mechanism of are dealt in with chapter 18. So onset and puberty in girls start with breast development. सबसे थैलार के कहते हैं. नंबर 1 is breast development between 8 to 13 years. Pubic hair, pubarche, then menstruation occurring at an average of 12.6 years, ranges between 10 to 16 years. Now the breast births may be tender and there may be a breast size. Early phases of the puberty. Now menarche usually occurs. Menarche मतलब वो periods. हाफ ईयर्स ऑफ थैलार्के मतलब ब्रेस्ट के डेवलप ब्रेस्ट 2 to 2.5 ईयर बाद ब्लीडिंग होना शुरू होता है. बॉयज़ में द अर्लीस्ट चेंज इज इंक्रीज इन द टेस्टिक्यूलर साइज. बॉयज़ ये होता है. फीमेल्स में ब्रेस्ट डेवलपमेंट होता है. वॉल्यूम रीचिंग 4 ml of or length 2. That occurs between 9 and 14 years. This is followed by appearance of lengthening of the penis. So spermarche जो होता है और production of the sperm starts mid-adolescent. Growth under the androgenic stimulus manifests as cracking of the voice and begins in mid-puberty in males and deepening at the end of puberty. Enlargement is seen in more than half of the boys, gynecomastia, which subsides spontaneously over several months. The onset of puberty is variable and thus is an age cohort. Student of class 7th. Many will have advanced puberty while others will be awaiting its onset. So physical growth and nutrition. पहले इसमें देख लेते, मेल का देख लेते. सो मेल में पहला जो होता है दीज आर नोन एज स्टैनर स्टेजिंग. तो सेक्शुअल रेटिंग 1 to 5 इन बॉयज़. 1 में क्या होता है प्री प्यूबर्टी होता है, टेस्टिकुलर साइज होता है. देन ये जो सेकेंड स्टेज है ना दैट इज़ टेस्टिकुलर का साइज बढ़ रहा है. ये पहला साइन होता है मेल्स में. सो कितना लीटर का हो गया? 4 लीटर का हो गया ना? रेडनिंग ऑफ स्क्रॉटम, स्क्रॉटम रेड हो जाएगा। 4 ml और लेंथ 2.5 centimeter. Scanty hair at the penile base. So the third stage is penile shaft. Okay. माय गॉड यार, इन लोगों ने इतना तेज बजा रखा है, मेरा पूरा रूम हिल में गाना बजाता है। लेट्स इग्नोर। इंक्रीज इन द लेंथ ऑफ पेनाइल। सेकेंड में क्या होता है, टेस्टिक्यूल का साइज बढ़ता है। थर्ड में पेनाइल शाफ्ट जो होता है ना वो बढ़ता है, उसका लेंथ। देन फर्दर इंक्रीज इन टेस्टिकुलर वॉल्यूम, हेयर बिगिंस टू कर्ल एंड डार्कन। फीमेल का हेयर कर्ल एंड डार्कन कब होना शुरू हुआ था? यही थर्ड में। इन गर्थ ऑफ द पेनिस, पेनिस का गर्थ फोर्थ में बढ़ जाता है, और ग्लैंड्स का भी। और डार्कनिंग ऑफ द स्क्रॉटम, स्क्रॉटम coarse, abundant and curly hair less than in adult. Now fifth क्या होता है, adult size of scrotum and penis. adult size में पहुंच जाता है। adult type of hair and the spreading growth and nutritional requirement देख लेते हैं। So during puberty about 20 to 30 centimeter, girls about 16 to 20 centimeter. ये height velocity in girls occur before attainment of menarche. Stage 3 जो भी हाइट होना है वो हो जाता है। वाइल बॉयज शो पीक ग्रोथ वेलोसिटी ड्यूरिंग द लेटर स्टेज ऑफ प्यूबर्टी, मेन ग्रोथ शो करते। सो द ग्रोथ स्पर्ट, स्केलेटन जो दूर वाला स्केलेटन होता है उसको पहले अफेक्ट करता है ग्रोथ स्पर्ट। एक्सट्रीमिटीज इज फॉलोड बाय इंक्रीज इन द ट्रंक। So there is exuberant increase in the muscle mass, particularly in boys, and total bone mass in both the sexes. Lean body mass increase in both the sexes. Girls at later stages of the puberty. Sense of sex steroid, rapid calcium accretion occurs during puberty, achieving almost mass. The recommended dietary allowance for calcium and intake of 500 ml of milk is this, with a cereal based Indian diet. With minimum sun exposure, the RDF 600 international unit per day. Since dietary vitamin D is mainly available from fatty fish, intake of pharmacological supplement may be necessary. Increase is paralleled by increase in blood volume and muscle mass, both of iron content. With commencement of menstruation of iron and further are further increased with diet and poor bioavailability. An adolescent need to have a daily intake of 20 iron in order to meet the daily requirement of 1.3 milligram. So the WHO recommends at least 60 minutes of daily physical activity with moderate to vigorous intensity to promote cardiovascular and muscular fitness. Health along with other psychological benefits. So cognitive and social development. Functional imaging technique shows that adolescent brain जो होता है undergoes subtle structural changes and differential growth. Though the exact unknown, these indicate reorganization and accommodating effort of brain paralleling the multifold increase in the functional capabilities. फेज में क्या होता है, लेट फेज में क्या होता है. अर्ली फेज में द कंक्रीट थिंकिंग model of childhood persists into early adolescence when the concepts are more concept. Teens are impulsive and have limited ability to perceive future behavior. They prefer same-sex peers, conscious of other people's concern about their appearance and action. Curiosity about peer is common. Mid phase में क्या होता है? This phase is marked by emotional autonomy. From their family, the youth starts to think beyond self and reasoning. Acceptance by the peer group becomes important. Sexual experimentation such as masturbation मिड फेज में. देन लेट फेज में क्या होता है? सो मिड फेज कितना होता है? 14 से आई गेस. या 14 to 16 is mid phase. Happens in late phase. By this time most of the pubertal changes are already. Moral values and strong self identity जो होता है are now able to suppress impulsivity and are less affected by peer pressure. Personal relation peer group. The youth becomes career oriented and planning for his या फिर her goal in life. Many starts engaging in sexual activity. Now attitude to. So adolescents are considered to be at the peak of their. Yet adolescent coincides with the orders. Girls are often unprepared for their first periods. High risk behavior is common in mid adolescent age group. The National Family Health Survey for NFHS median age of sexual debut in boys and girls is to be 24 years, but a significant proportion are sexually active much before. Contraception is improving among adolescents, though awareness about HIV is increasing among Indian youth. knowledge of the disease. So problems क्या होता है, तो पहले ये टेबल देख लेते हैं जिसमें है कि प्रॉब्लम फेस्ड बाय एडोलेसेंट। हेल्थ प्रॉब्लम क्या होता है, न्यूट्रिशन एंड ईटिंग डिसऑर्डर। सो एनीमिया हो सकता है, विटामिन डी डेफिशिएंसी, ए डेफिशिएंसी, लॉन्ग बोन हो सकता है। देन मेंटल हेल्थ प्रॉब्लम हो सकता है, एंजाइटी, डिप्रेशन, सुसाइड, डेलिंक्वेंसी, मूड, पुअर स्लीप, डे टाइम सोमनिलेसेंस, पुअर एकेडमिक, स्नोरिंग। इन्फेक्शन हो सकता है, टीबी, एचआईवी, एसटीडीज हो सकता है रिलेटेड टू मेंस्ट्रुएशन, जैसे मेंस्ट्रुअल हाइजीन, पीसीओएस हो सकता है। लाइफस्टाइल डिजीज़ भी हो सकते हैं, लाइफस्टाइल डिजीज़ जैसे ओबेसिटी, टाइप 2 डायबिटीज़, हाई अब्यूज़ जैसे टबैको, अल्कोहल और अदर्स ये लोग कर सकते हैं। वल्नरेबिलिटी, तो अब्यूज़, वायलेंस, एक्सीडेंट के बहुत वल्नरेबल होते हैं बच्चे। ट्रॉमा, बर्न ये सब हो सकता है। माइग्रेशन में चाइल्ड लेबर, ट्रैफिकिंग, प्रोस्टिट्यूशन, एचआईवी। एडोलेसेंट प्रेगनेंसी में क्या प्रॉब्लम आएगा, अर्ली मैरिज, सेक्सुअल अब्यूज, लैक ऑफ सेक्स एजुकेशन में नो फॉर्मल एजुकेशन और मास्टरबेशन, सेफ सेक्स, डेटिंग, अबॉर्शन, एचआईवी एंड एसटीडीज, अनट्रस्टेड इंफॉर्मेशन सोर्स, चेंजेस। पॉल्यूशन की वजह से एस्मा हो सकता है, स्किन कंडीशन, एंडोक्राइन डिसरप्शंस, पॉसिबल मैलिग्नेंसीज हो सकता है, violence, unrealistic expectation, poor role models and social isolation, depression in children. Now, peer pressure की वजह से high risk behavior and addiction, undernutrition, depression, antisocial behavior and early sexual activity. Academic stress की वजह से सकता है डिस्क्रिमिनेशन, पेरेंटल एक्सपेक्टेशंस हो सकता है, डिस्क्रिमिनेशन की वजह से नो डिसीजन मेकिंग पावर, जेंडर डिस्क्रिमिनेशन is so problem faced by adolescents. So adolescents are because of the rapid changes in their hormone milieu, changing ideas and concepts about the world, the expectation from society and the need to establish their own identity. The problem faced by an adolescent are diverse and are often not addressed by the healthcare system. So health problem क्या होता है, nutritional and eating disorder. There's a period of rapid growth and micronutrient being important as energy and protein. So data of NFHS 5 shows that 57%, 31% of the boys are anemic. The prevalence of anemia has remained unchanged over the last 3 decades. The so due to clothing with dark skin pigmented. Insufficient intake of dairy product results in poor intake of calcium and vitamin B12. Now, the resulting low bone mineral density is more pronounced in underprivileged girls. Protein intake, in addition to the calcium and vitamin D deficiency. Vitamin A deficiency जो होता है is also an important issue in economically. So undernutrition often delays the onset of puberty and sexual maturation. So results in stunting, equal and reduced work capacity, suffer from malnourishment due to gender discrimination in food distribution, whereas girls from urban upper socioeconomic group shows एनोरेक्सिया नर्वोसा और बुलिमिया जो है आर इंक्रीजिंगली रिपोर्ट Now, mental health problems. So एडजस्टमेंट एंड एनजाइटी डिसऑर्डर जो होता है, हाय मम्मी, हाय शंक, हेलो एवरीवन, हेलो मिस्टर ओझा, आराध्या ओझा, हेलो. सो वी आर रीडिंग अबाउट अडोलेसेंट और उनके प्रॉब्लम आता है उनको. एडजस्टमेंट और एनजाइटी डिसऑर्डर्स और डिप्रेशन, suicide, delinquent behavior, poor body image, low self esteem, sit at a median age of 14 years. So, suicide or with a higher number of completed suicide in boys, अटेम्प्टेड सुसाइड इन गर्ल्स. कंप्लीटेड सुसाइड बॉयज़ में ज़्यादा है और अटेम्प्टेड सुसाइड जो है वो गर्ल्स में ज़्यादा है. सो अडोलेसेंट्स committing suicide because of cognitive immaturity and disorders like depression or mood disorder, substance abuse, physical or sexual abuse, family history of suicide makes them prone for such attempt. Sleep of rapid growth, adolescents have increased sleep requirement. Delay in melatonin secretion, adolescents have delay in sleep onset and awakening by. In urban adolescent, this may be compounded by increase in the academic activity or watching electronic screens late into the night. Reflect in school performance and causing daytime drowsiness. Conduct disorder, anxiety, restless leg syndrome. ना इन्फेक्शन, ये अडोलेसेंट लोगों को क्या क्यों वो लोग प्रोन टू इन्फेक्शन. इंक्रीज्ड आउटडोर एक्टिविटी, teens are exposed to TB, HIV, skin and parasitic infection and STDs. So early sexual activity is not uncommon. Various biological incomplete estrogenized mucosa जो होता है and lack of preparedness, knowledge regarding barrier contraceptives make a infections. Gonorrhea can cause vulvovaginitis, urethritis and क्लामाइडिया जो होता है वो कॉज करेगा इंटरमेंस्ट्रुअल और पोस्ट कोइटल ब्लीड. बोथ में बी एसिम्टोमेटिक इन द मेजॉरिटी एंड डिस्चार्ज. कैंडिडियल इन्फेक्शन जो होता है ये कॉमन होता है विथ स्टार्टिंग ऑफ मेंस्ट्रुएशन and have often a cyclic nature. PID जो होता है स्पेक्ट्रम ऑफ इन्फ्लामेटरी डिसऑर्डर फीमेल के जेनाइटल ट्रैक्ट में होता है विच अकर्स इन सेक्सुअली एक्टिव फीमेल्स एंड कैन परसिस्ट विथ abdominal पेन. तो लोअर abdominal, हेलो मम्मी, लोअर abdominal सर्वाइकल या फिर एडेनेक्सिया करता है डायग्नोसिस के लिए. ना इश्यूज रिलेटेड टू मेंस्ट्रुएशन. So there are many social taboos about the menstruation in Indian families. Many adolescent girls during their menstruation because of lack of access to safe sanitary products and lack of hygiene may contribute to reproductive infection. While the introduction of government and private scheme, more young women are now able to access hygienic methods. It is common to have an ovulatory या फिर irregular menstrual cycle during the first 2 years of a combination of menstrual irregularities and ovarian cyst with androgen excess like acne, hirsutism occurs in 9%. Na, 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 na. सेलियंट फेजेस और ट्रीटमेंट गोनोरिया जो होता है उसमें को इन्फेक्शन कॉमन होता है, उसके लिए सिर्फ ट्रायोक्सोन दे देते हैं। क्लमाइडिया का जो इन्फेक्शन होता है यूरेथ्राइटिस और वेजाइनल डिस्चार्ज उसमें होता है। हर्पिस में मल्टीपल पेनफुल वेसाइकल और अल्सर होगा, टेंड टू रिकर, ए साइक्लोवेर दे देंगे। प्राइमरी सिफिलिस में पेनलेस जेनाइटल अल्सर होता है, पेनिसिलिन देंगे, विल गिव। जेनाइटल वॉट्स में रिकर करेगा बार बार, प्रोफाइलिन सर्जिकली प्रिवेंटेबल विद वैक्सीन, क्रायोथेरेपी या फिर सर्जरी से निकलवाते हैं जेनाइटल वॉट्स। शैंक्वाइड जो होता है वो पेन, लिम्फेडिनोपैथी, अजीथ्रोमाइसिन देंगे, सिप्रोफ्लॉक्सासिन भी दे सकते हैं। ट्राइकोमोनियासिस जो होता है उसमें मैलोडोरस मैल होगा, इसमें मेट्रोनिडाजोल देंगे। कैंडिडियासिस जो होता है उसमें इचिंग होगा, रेडनेस होगा, वाइट डिस्चार्ज होगा, क्लोट्रीमाजोल। एडी में पॉली माइक्रोबियल वेरिड डिजीज स्पेक्ट्रम होगा, माइल्ड टू मॉडरेट में सेफिक्स, मेट्रोनिडाजोल देंगे, डॉक्सी देंगे, आईवी। पेडिक्यूलोसिस प्यूबिस में प्रोराइटिस जो खुजली करेंगे। देन स्केबीज में प्रोराइटिस एंड रैश होगा, परमेथ्रिन 5% देंगे। Now what we are reading कि the condition is associated with other जैसे कि ओबेसिटी, इंसुलिन का रेसिस्टेंस, टाइप 2 डायबिटीज मेलाइटिस। अब लाइफस्टाइल डिजीज देख लेते हैं। So obesity is epidemic in urban settings. Among Delhi school girls, 5% overweight have been reported, higher in boys than in girls. Asthma, sleep disorder, reflux disease, blout disease, slipped gallstone, fatty liver, metabolic derangement, dyslipidemia, hypertension, PCOS। ना एसेंशियल हाइपरटेंशन जो होता है वो बढ़ रहा है और प्रेवलेंस उसका 29% है इन नॉर्मल वेट में। स्कूल चिल्ड्रन इन अ रिसेंट मेटा एनालिसिस फ्रॉम इंडिया। माय गॉड, देयर इज अ लॉट ऑफ साउंड यार। ना बजाता है ना, कौन बजाता है? हेलो, सो NFHS5 जो है शो करता है 40% से 20% जो मेन होते हैं अबव द एज करते टबैको और अल्कोहल को रेस्पेक्टिवली। इन बोथ मतलब 40% टबैको कंज्यूम करते, 20% in both urban and rural India, starting as early as 10 years. The percentage in female are also increasing. So, the Global Youth Tobacco Survey 2019 shows that around 20% school children जो होते हैं experiment with tobacco using it. 20% एक्सपेरिमेंट करते हैं और 8% जो वो करते रहते हैं. अपार्ट फ्रॉम टबैको, अल्कोहल, कैनाबिस और ओपियम जो है वो मोस्ट अब्यूज्ड सब्सटेंस है. Addiction are prone to accident, injuries, violence, trade, sex for drug, HIV, hepatitis B, sexually transmitted disease, and tuberculosis. Oh my god, this is just taking away my patience. Now, vulnerability, abuse, and violence, physical and sexual. So, physical and sexual violence are common in India, with 20 to 30% of the young female suffering from domestic violence, and 2% young female experience sexual violence before their 18th birthday. Road traffic and in boys, burns जो होता है वो पॉइजनिंग जो होता है आर लीडिंग कॉज ऑफ ट्रॉमेटिक मोर्टेलिटी एंड सो माइग्रेशन मेनी टू अर्बन सेटिंग फॉर लेबर एजुकेशनल अपॉर्चुनिटी is a serious problem in India and happens for industrial and domestic labor. In some states, 70% of the new HIV infection are male migration. So, adolescent pregnant are likely to resort to unsafe method of abortion, which increases risk of septicemia and mortality. As compared, they are also at higher risk of preeclampsia, preterm labor. Prolonged and obstructed labor are common in adolescent pregnancy. 4 times more likely to die during childbirth as compared to adult female. Neonate, infant, and child mortality rates are higher in children delivered to adolescent mother. Fortunately, the prevalence of adolescent pregnancy 8% is lower in the result of NFHS4 than in previous surveys due to schooling and knowledge about contraception. So, environmental and social changes. ये क्या है? Media with easy availability of electronic media, adolescents are exposed to unsupervised information from all across the world. Adolescents often succumb to glamorous portrayal of tobacco and alcohol consumption, unrealistic expectation, physical aggression, destructive behavior, and unprotected sex. Spending much of the sparse time indoor on a social networking app, teenagers are deprived of the sunlight and physical activity and socially isolated. So, peer pressure, peer formation is a part of adolescent social development. Pressure for conforming to norm drives many of their action and decision, including risk-taking behavior and initiation of substance abuse. So, academic and emotional stress. Examination causes a significant physiological and psychological stress. Switching from vernacular to English medium school, long hours of school and tuitions are additional stress factors that are unaddressed. वेरियस अदर फैक्टर्स जैसे कि पीयर का एक्सेप्टेंस, डिस्क्रिमिनेशन, academic burden, parental expectation, and changing school environment causes stress among youth. While most adolescents have adequate coping skills, some have serious adjustment problem resulting in psychological and somatic effect. Early marriage. Though the legal age of marriage in India is 18 years for girls, the practice of childhood and early marriage is still quite common. Among the adolescent girls, 30% जो है वो married है, more so in rural areas. So, discrimination. Young people are often treated as second class citizens under the control of adult and often not involved in any decision making. Adolescent girls are often asked to limit their outdoor extracurricular activities, confined to their houses and expected to do household work. Gender discrimination is seen in education and even in food distribution. So, definition of child and below 18 year. Definition: minimum age for marriage, बॉयज़ का 21 से, गर्ल्स का 18 है. रिस्पॉन्सिबिलिटी फॉर क्राइम 12 साल के बाद से रिस्पॉन्सिबिलिटी लेना पड़ता है क्राइम के लिए. जुवेनाइल क्रिमिनल 18 to 20, 12 to 18 ईयर्स. कंपलसरी फ्री एजुकेशन 6 to 14 ईयर्स तक मिलता है. Consumption of alcohol beyond 18 to 25 years in different states, illegal in some states and union territories. Employment in hazardous occupation or hotel 14 years. What is this behavior, yaar? How is anyone going to study in this kind of a behavior? Role of healthcare provider. So, a checklist for an adolescent clinic visit is provided. During each visit, the following are important. Identifying risk. The physician needs to detect risk factors जैसे कि obesity, hypertension, possible substance, drug abuse, behavior and social problems, risky behavior. Subtle cues like sad depression, mood, avoidance of eye contact, bruise, undue resistance to examination are likely pointed towards physical or sexual abuse. Establish rapport. Being empathetic and non judgmental is the key to effective communication. Direct questioning of the adolescent is as important as questioning the parent. So, beginning the interview with ice breaking of open ended, non sensitive questions and then moving to sensitive or targeted question is helpful. So, confidentiality. One may need to intervene a young patient separately, and she may not want to discuss sensitive topic in the presence of parents. While examining the genitalia, the doctor can ask the patient's preference for presence of their parent inside the examination room. A boy may prefer his parents standing outside the examination room, whereas a girl may find it comforting if her mother accompanies her during the examination. Consent. So, for a child who is less than 12 years, consent for examination or medical surgical procedure is obtained from the पेरेंट या फिर गार्जियन. 5 साल से कम वाले बच्चों के लिए पेरेंट या गार्जियन कंसेंट देते हैं. While an adolescent aged 12 to 18 years can give consent for examination, consent for medical surgical procedures can be given only after 18 years. This also includes consent for medical termination of pregnancy, blood या organ donation. So, nutritional health interventions. Providing the nutritional status of adolescent girl breaks the cycle of malnourishment and low birth weight babies and prevent long-term complication of the latter in future generations. Providing health information. The adolescent health visit is an excellent opportunity to talk to the parent and their adolescent about their pubertal changes. It is likely that they have not received any formal sex education in school and needs to be provided correct educational resource for the same. Reference to social services, psychological evaluation and support. The National Commission of Protection of Child Right Act 2005 considers a person below 18 years as a child. It is mandatory for a healthcare provider to report all cases of child abuse, even suspected, to the commission, online or in writing. Doctors are proceeded in the case of erroneous reporting but punishable if they fail to report. So, adolescent with special need या फिर victim of any kind of abuse needs social या फिर psychological support. Adolescent friendly health clinic. These services include provision of reproductive health services, nutritional counseling, sex education, life skill education, confidentiality, easy accessibility, friendly attitude, and quick comprehensive healthcare delivery have made a possible impact on adolescent clients. Adolescent reproductive and sexual health has been identified as the key strategy under RHC2 program. Adolescent friendly clinics are functional at many centers in the country. So these are the checklist of adolescent health visits. History from parents and adolescent. History of presenting problem. Parental concern on growth development, academic success, school absenteeism, diet including calcium, protein, iron, calorie dense food, menstrual history, sleep problem. Separate questioning of the adult, emotional problem, relationship with family and peers, outlook towards physical and sexual changes, involvement and relationship of sexual activities, awareness about safe sex, contraceptive, specific problem related to sex organ, tobacco or other substance use, counsel with clear doubts on sensitive topics, separate questioning of parent, relationship with family, level of communication on sensitive matters, unusual behavior noticed. So physical examination में anthropometry, BP, markers of obesity, acanthosis, sexual maturity rating, signs of malnourishment, anemia, vitamin deficiency, signs of skin and genital infection, level of general hygiene, signs of trauma, abuse, signs of drug abuse या फिर tobacco use. काउंसलिंग करना है, न्यूट्रिशनल इंटरवेंशन, हाइजीनिक प्रैक्टिस, बिल्डिंग rapport between parents and adolescent, providing information and resources on sex education. इंटरवेंशन इन्वेस्टिगेशन क्या होगा, हीमोग्लोबिन लेवल, ब्लड शुगर, लिपिड प्रोफाइल, जेनाइटल स्वॉब, अल्ट्रासाउंड ऑफ ओवरीज. सो रेफरल्स क्या है, काउंसलर को रेफ़र कर दो, डाइटिशियन, साइकियाट्रिस्ट, गायनिकोलॉजिस्ट, voluntarily and confidential HIV testing, social services and child protection agencies and support groups. Now management of sexual violence, आप कैसे मतलब sexual violence का कैसे मैनेजमेंट किया जा सकता है. So forensic examination and collection of blood and body fluid samples by trained staff, care of injuries, prophylaxis against pregnancy, 2 doses of levonorgestrel 12 hours apart, first dose being given 72 hours after the intercourse. Prophylaxis against STI includes single oral dose of azithromycin with cefixime and metronidazole and tinidazole. Protect against syphilis, gonorrhea, chlamydia and trichomonias. Hepatitis B का vaccination ले लो is recommended if the person is not previously immunized. Now, prophylaxis against HIV requires referral to the nearest integrated counseling and testing center. Psychological support include counseling and referral to a psychiatrist, informing concerned authorities or social services is important as patient may need shelter and legal help. A teen may not be willing to disclose this assault to the parents. Childline 1098 is a support service provided by Government of India, focuses on child care and protection. Now, healthy adolescent package of interventions. Healthy lifestyle. So, healthy food, exercise, and yoga. No to tobacco, alcohol, drugs. Safe conduct on road. Papilloma virus या rubella. Anemia में prevention, detection, management of anemia, especially for adolescent girl. Sexual health में sexuality, education, menstrual hygiene, marriage after 18 years, childbirth after 20 years, counseling and services for comprehensive sexual and reproductive health including contraceptive. Mental health में supportive family counseling and peer या family support in anxiety, depression, prevention and management of hazardous and harmful substance, prevention of suicide and management of self-harm, suicide risk, violence prevention, so prevention and management of unintentional injury, prevention of and response to sexual and other form of gender based violence. So communicable and non-communicable disease में क्या है? Prevention, detection, treatment of communicable and non-communicable disease. Prevention for adult, preparation for adulthood में क्या है? Parenting skills बच्चों को सिखाओ, responsible husband, wife and father. Now, protection of children from sexual offense. पॉक्सो है, पॉक्सो, प्रोटेक्शन ऑफ चिल्ड्रन. किनका प्रोटेक्शन? प्रोटेक्शन ऑफ चिल्ड्रन फ्रॉम सेक्सुअल ऑफेंस एक्ट 2012 में आया है, अमेंड 2019 में हुआ है. द पॉक्सो एक्ट प्रोटेक्ट्स इंडिविजुअल बिलो 18 ईयर्स फ्रॉम सेक्सुअल ऑफेंस और हरासमेंट ऑफ एनी फॉर्म, बी इट फिजिकल या pornographical. It also explicitly states that an event of abuse must be informed to legal authorities, failing which the knowing person, including the healthcare provider, is liable to legal action including imprisonment. Now, contraception क्या है कि a pediatrician should advocate for abstinence and delayed initiation of sex to adolescent patient. In case of adolescent is already sexually active, condoms seem to be a better choice compared to other methods. Adolescent with disabilities or mental retardation are wrongly assumed to be at lower risk of STIs and pregnancies. Um, Parents of such children need to be counseled regardless of the issue. Now, adolescent immunization. India has low coverage for booster doses of TT at 10 and 16 years. ह्यूमन पैपिलोमा वायरस HPV वैक्सीन जो होता है रिकमेंड किया गया फॉर पेरीप्यूबर्टल गर्ल्स बिफोर इनिशिएशन ऑफ सेक्सुअल एक्टिविटी फॉर प्रिवेंशन ऑफ इन्फेक्शन with HPV and cervical cancer. Parent needs to be counseled thoroughly as the principle behind giving the vaccine might alarm them. Transition to adult care. So with better medical care, a large number of chronologically ill या फिर disabled children जो है are surviving into adulthood. As the problem of these children are diverse, they need multidisciplinary care even in their adulthood. Transition to adult care is not mere transfer of the case to a different physician. It is a gradual and planned process, keeping in the mind the ability of children to participate in self-care, taking responsibility and decision making. The age at transfer is not fixed. A window of age 14 to 18 year is used in some countries for gradual transfer. So immunization during adolescent, TD जो है टॉक्सॉइड और एसेलुलर पर्ट्यूसिस यानी TDAP वैक्सीन जो है TDAP एट 10 से 12 साल में एक देंगे और एवरी 10 ईयर्स देर आफ्टर देंगे. TD जो है एट 10 and 16 ईयर्स पर एज पर नेशनल प्रोग्राम देंगे. HPV जो है हम लोग 2 डोज देंगे इफ़ गिवन बिटवीन 9 to 14 ईयर्स और 3 डोज देंगे अगर 15 साल के बाद दे रहे तो. इन्फ्लुएंजा एनुअली वैक्सीन दिया करेंगे. Government interventions in adolescent healthcare. So, Kishore Shakti Yojana or Sabla Yojana aims to provide health and nutrition education and vocational skills to adolescent girls. National Youth Policy believes in youth empowerment through education. Recognizing the contribution of adolescent care to maternal and child health, National Health Mission now follows reproductive maternal neonate child adolescent health RMN C plus A approach. Under this program, weekly iron folic acid supplementation program provides 100 mg iron and 500 microgram of folic acid with biennial deworming to all the adolescent attending government schools. The राष्ट्रीय किशोर स्वास्थ्य कल्याण जो होता है under the RMNC plus A extends the spectrum of adolescent care from reproductive and sexual health to non-communicative disease, violence, injuries, substance abuse or mental health. Thank you guys, the chapter has ended and we are parting ways. Adieu.